Hi, I'm Dr. Soehnlen. I'm an orthopedic surgeon who specializes in the treatment of hip and knee pain. So one of the great things about being a group, the size that ours is, as well as diverse of surgeons as we have, is anytime I see something that's just not, just a little bit out of the ordinary, I'm making phone calls, texts to my partners on a regular basis. Hey, what do you think here? Have you seen this? It's wonderful to be able to have that, built-in second opinions. I'm making phone calls all the time, being able to get that, even if it's just encouragement that you're doing the right thing for this complex patient. Another thing that we understand is that it can be very difficult as a patient to navigate the healthcare environment, right? So we also understand that injuries seem to more often than not happen after hours or at a very inconvenient time. So one thing that we've developed in response to that is our express care, available at both of our main offices. We understand these accidents often happen at inconvenient times, and we do offer express care for walk-in injuries. Additionally, we also understand that navigating things can be very difficult between facilities, so we try to offer as many things we can within our umbrella, including both physical therapy as well as advanced imaging, including MRI and then x-rays right there in the office.